Well, I welcome you all. I welcome you all. I would like to start my video of today regarding the topic anesthesia. My dear friends, myself, Professor Dr. Rajendra Deshpande, would like to welcome you all in my Ayurveda Academy channel. This channel is basically prepared for all students from first year, second year, third year, fourth year BMS students. But of course, these videos are also useful for MBBS, homeopathic, naturopathic, every type of the students from the medical fraternity. So today's topic is related with the fourth year BMS students under the subject Shalya Tantra or surgery. This is Ayurvedic curriculum, Ayurvedic syllabus is including Ayurvedic aspect as well as the modern aspect. Try to understand. And these questions are always asked in the examination. Myself, Professor Dr. Deshpande, I am MD in Ayurvedic medicine and MD in Ayurvedic physiology. My WhatsApp number is 922681060. My dear friends, this anesthesia video may have the two parts. Number one is the local anesthesia, and in the second part, in the second video, I will talk about general anesthesia. So today's video is restricted to the local anesthesia. Okay. Purpose of this VPT, this is based on the Shalya Tantra syllabus of CCIM 2012. Points covered are paper 1 part A point 4, paper 1 local anesthesia, paper 1 part A point 4 regional and general anesthesia. So about general anesthesia, the video will be the next video. Okay, topics covered in this video: types of the local anesthesia is covered, yes, drugs used in local anesthesia, but general anesthesia and drugs for general anesthesia, muscle relaxation, stages of GA, spinal anesthesia, comparison of LA and GA, local and general anesthesia will be done in the next video. So try to understand. In this video, only first 2 points are covered. Okay. Local anesthesia, reversible. Try to understand. It's a reversible depression of nerve cell conduction. A patient becomes unaware of the sensitization because we have to do some invasive procedures. The patient should not feel the pain of it. So temporary loss of sensation and relief from the pain. Temporary loss of sensation and relief from the pain. Now, equipments for anesthesia. Of course, this is for general anesthesia: laryngoscope, endotracheal tube, ambu bag, Boy's apparatus, pulse oximeter, cardiac monitor, BP instrument, stethoscope, spinal needle, tray of emergency drug, suction catheter, and O2 cylinder. Now, this is the anesthetic machine. You can see Boy's apparatus. Pre-anesthesia. Physical fitness is must from the physician. Control of diabetes mellitus and blood pressure. Oral hygiene. There should not be pyorrhea like the septic focus, loose or artificial dentures. Nutrition and hydration also should be normal. Of course, I know. This is something more related with the general anesthesia. I will repeat. Baseline lab reports should be normal. Always preoperative physical fitness, physician's fitness, and number two, lab. We have to do the lab. Lab means laboratory. Hemoglobin, blood sugar, kidney function test like urea creatinine, LFT, bilirubin, SGOT, SGPT, and of course, electrocardiogram. Systemic examination, respiratory system, cardiovascular system, digestive system, all should be perfectly normal. Grades of patient by American Society of Anesthesia. Okay, American Society of Anesthesia, grade 1, no abnormality. Grade 2, mild systemic disorders. Grade 3, severe systemic diseases. Grade 4, life-threatening severe systematic diseases. Grade 5, highest risk. And grade 6, unfortunately, dead condition, dead person. But always this is done to how we should be very, very careful, especially about general anesthesia. Anesthesia pre-medication. Number 1, tablet compose, diazepam, 1 hour previous night of operation as a tranquilizer to make the mind cool and calm, because patient is always anxious. Oh, what will happen about my surgery? Oh, my surgical operation operative will be all right or not? whether I will be alive or dead. Lot of tension. So compose is there. Injection compose at the time of surgery. Injection atropine 0.6 milligram intramuscular. This reduces the secretions from all over GI tract. Secretions, atropine. Okay. Types of local anesthesia. Number one, infiltration anesthesia. Number two, field block. Number three, nerve block. And number four, surface anesthesia. Infiltration anesthesia. First, local anesthetic drug is injected into the area which is to be incised in a circular manner. Here, give little amount. For example, it is used in excision of lipoma, fat lipoma, take out lipoma, polyp, and dermal cyst. You have to give infiltration anesthesia in a circular manner. Okay. Anesthetic is infiltrated into the tissues to be operated upon. This is very useful for the small skin lesions, for suturing also small lacerations. Xylocaine with adrenaline is always used for infiltration anesthesia, xylocaine. But if longer duration of action is required, another medicine. Remember, bupivacaine. Write down, bupivacaine, long-term anesthetic. In case of the lacerated wound, the injection may be given from inside the margin of the wound, inside. In palm, soles, nose, infiltration is very difficult. Why? Why? Because skin is tight. Skin is tight over here. So it's very difficult for infiltration anesthesia. For infiltrating dome of an abscess, a small quantity is given by insulin syringe very superficially. For infiltration anesthesia, insulin syringe is used. Remember, for abscess. Next, second, local anesthesia, field block. Zone of the analgesia is created around the operative field by injecting local anesthetic. This is used, field block, in the minor surgery when unconsciousness with general anesthesia dangerous. So it is like a option for general anesthesia. When general anesthesia grade 4-5 patient is there, very serious complications possible, give the field block. Okay. Nerve block, third type of local anesthesia. Nerve block. Local anesthetic drug is injected near the nerve which is supplying the operated area. For example, brachial block. Finger, here. This is paronychia. If I want to remove this nail, very infected, bad nail, gangrene, okay, then I have to give here, ring block, nerve block, ring block, intercostal nerve block, okay. Regional anesthesia. Particular area is anesthetized by a field or nerve block for removal of the sebaceous cyst on the back. Field block can be used. Local anesthetic is infiltrated on the skin of the back in the area encircling the cyst. Yes. In nerve block, the anesthetic drug is deposited near the nerve, sensory nerve. Then flooding technique, flood like a flood, flooding technique. As there are anatomical variations in localization of nerves, large volume of anesthetic drug is given in wider area, in flooding wider area. Injection should never be given into the nerve. No, never into the nerve. And that can be, how you can say that my injection has been given in the nerve? When you give in the nerve, what will happen? Paresthesia during the infiltration. Paresthesia will occur while you are giving the injection. Be careful. That can be dangerous. You should not give any injection into the nerve. No. Okay. Examples of the nerve blocks. Supraorbital nerve block. Supraorbital. Okay. To anesthetize the skin of the forehead here. Digital nerve block here. I already told you. But this ring block should be always without adrenaline. Remember, ring block without adrenaline. Nerve, this is ring block without adrenaline by blocking dorsal digital nerve whole finger is anesthetized, but never use xylocaine with adrenaline. You should have to use xylocaine without adrenaline. Yes, that's correct. Median nerve block. This nerve lies behind the palmaris longan tendon at the wrist. This will anesthetize the thumb, index finger, middle finger, and half of the ring finger corresponding of the area of palm, dorsal, and palmar aspect. Median nerve block. Local anesthesia. Can you see the pictures? Dentists always use this type of the local when they want to extract your tooth, when they want to do cleansing of the tooth, root abscess, root canal, every time they give this type of the local anesthesia. Okay. Ulnar nerve block. This will block the little finger and medial half of the ring finger. A combined median and ulnar block will anesthetize the whole hand. What? Together, median and ulnar block. Posterior tibial nerve block. Xylocaine is injected just anterior to the Achilles tendon at the level of median malleolus. On the leg, yes, on the leg, used in the case of injuries on plantar aspect of the foot. Posterior tibial nerve block. Okay. Calcaneal. You know the calcaneal spur is a problem, overgrowth of the bone. Calcaneal nerve block, 5 ml of xylocaine is injected as a band into the skin below the level of the medial malleolus. Skin of the heel is anesthetized. Useful for removal of corn, C-O-R-N, corn, for suturing laceration in plantar skin. Useful for giving steroid injection to a patient of plantar fasciitis. Next, nerve block. We are taking a lot of example of nerve blocks. Local anesthesia, ankle block. This will anesthetize whole foot, but very rarely used. Penile block, penile, never used. Digital, no xylocaine with adrenaline. Similarly, in the penis, penile block, never use xylocaine with adrenaline. Use plain xylocaine. There is a color differentiation. You can identify by the color on the bottle. Complete ring block is not required because nerve enters only along the dorsal aspect. Where penile block is given on the penis, useful for circumcision and for correcting paraphymosis. There will be separate videos for circumcision, paraphymosis, but this is we are local anesthesia. Okay. Surface anesthesia, surface anesthesia. Local anesthetic agents is used in the form of spray, okay, ointment, cream, jelly, lotion. What? To anesthetized surface skin. Number 1, used in the catheterization. Number 2, cystoscopy. Number 3, insertion of rice tube. Just put a local surface that anesthetic material and surface anesthesia will be there. Anesthesia is obtained by application of local anesthetic drug to the surface of skin or mucous membrane. IMLA skin cream, E-M-L-A, IMLA skin cream. It contains Lignocare and Prelocaine. With this cream, anesthesia is produced after 1 hour after thick application. Mucous membranes can easily anesthetized by eye or ear drops, throat lozenges, and rectal jelly. All these are the surface anesthesia. Spinal and epidural anesthesia, both are the types of local anesthesia. Advantages of local anesthesia: simple and easy to administer. Body metabolism is not disturbed, so special attention is not required like general anesthesia. Less bleeding will be there. Very cheap compared to general anesthesia. In spite of these advantages, some patients prefer general anesthesia due to the fear of remain conscious during the operation. Some patients are fearful. They don't want local anesthesia. They don't want to see what the surgeon is doing. Okay. Examples of medicine for LA: specialty of the drug and the name of the drug. Low potency and short acting, Procaine. Low potency, short acting, Procaine. Moderate potency, moderate duration, Xylocaine, that means lignocaine. Lignocaine, xylocaine, same. Lignocaine, xylocaine, and high potency, long duration, bupivacaine, bupivacaine, marcaine, bupivacaine, marcaine. Okay, these are the all medicines of local anesthesia. Local anesthetic drugs, commonly used drugs are procaine, lignocaine, either plain or with adrenaline, amitrocaine, and bupivacaine. Then procaine, that is novocaine, and amitrocaine, that is tetracaine, less potent and give frequently hypersensitive reactions. You must note this point, allergy. Now, first, lignocaine or xylocaine, most commonly used, stable and can be stored at room temperature. Onset of action is very quick and duration of action ranges from 30 to 60 minutes depending on local, how much vessels are there, vascularity and site. Addition of adrenaline into the xylocaine 1 in 2 lakhs prolong the action up to the 2 hours. Available as 2% solution with or without adrenaline. Xylocaine, we are talking about xylocaine, 2% solution with or without adrenaline. Adrenaline usually combined with lignocaine. Advantages are adrenaline is a local vasoconstriction, so less amount of xylocaine or lignocaine is absorbed, by which this xylocaine remains in tissue for longer time, and we get the prolonged local anesthetic effect. Combination is useful in highly vascular areas, like for example face or the skull. Xylocaine with adrenaline, it gives a dry operative area within 10 minutes. Adrenaline, although there are a lot of advantages, but risk equally is there. Risk is there due to the effect of local vasoconstriction. It is used if by chance somebody, by chance doctor, unknowingly by error, he used around the end arteries. For example, here digit and second is penis. Digit, penis, digit, penis. It will cause gangrene if student uses xylocaine with adrenaline. Digit and penis cause gangrene, dangerous. Be careful, be careful. So lignocaine with adrenaline should be avoided at digits, tip of the nose, pinna of the ear, and shaft of the penis. 4 places you must remember. Xylocaine with adrenaline should not be used. Should not be used. Digit, digit, finger, tip of the nose, pinna of the ear, and shaft of the penis. Okay. Plain and lignocaine with adrenaline are available in different color bottles. So no problem. You must look to the bottle carefully. Reaction to the lignocaine. Sometimes anaphylactic reaction is also possible. Of course, it is rare, fortunately, but test dose should be given. Reaction occurs due to use of large doses or large amount of enters into the systemic circulation. Aspirate before injecting locally. That is called, be careful, it should not go into the blood. Needle should be kept constantly moving forward and backward, forward and backward. So even if needle enters into the blood vessel, very small amount will enter into circulation and anaphylaxis can be prevented. Lignocaine poisoning by chance. Hypotension, BP will be low. Bradycardia, pulse will be less. Heart block can occur. Bupivacaine, that is marcaine, more prolonged action, 4 times more potent than xylocaine. So popular for spinal anesthesia and painless labor. Painless labor, bupivacaine. So benefit of in minor surgeries in the GP level, general practitioners level. For LA, inquire about the history of allergy to the anesthetic drug. Do not exceed the toxic dose. Be careful in patients with heart and liver disease. Select proper site for nerve block. Avoid accidental intravenous injection. Keep watch on pulse, bradycardia, low pulse, and twitching on the face. Twitching on the face. These are early signs of toxicity. Lignocare used for nerve block and infiltration 0.5 to 2%, ointment 2%, eye drops, 4%, spinal anesthesia 5%, dose 5 milligram per kg. Lignocaine caution. Lignocaine with adrenaline should never be used where end arteries are present, tip of the fingers, lips, and ear penis. Otherwise, vasoconstriction effect, necrosis will occur. Lignocline with adrenaline is contraindicated in MI, myocardial infarction, and hypertension. Dose of lignocane with adrenaline 5 to 7 milligram per kg, maximum 300 milligram. Bupivacaine, basically this is a long-acting anesthesia but can be used for local anesthesia. Maximum dose 150 milligram, duration of action 4 to 6 hours. Local anesthesia disadvantages, there may be sometime allergic reaction from minor to serious like anaphylactic shock, even for xylocaine, nerve or the vessel injury. Lignocane cannot act in the acidic condition of pus. Remember this thing. Whenever abscess, pus is there, it will not act. This is all about local anesthesia. In today's video, we started to discussion about anesthesia. In the next video, I will talk to you about general anesthesia, very important topic for examination and viva and oral, 4th year BMS, Shalya Tantra subject. Do you want any advice for any health problem? WhatsApp 9226810630. Sorry, these are paid services. Dear students and doctors, do you want any video on specific topic? We make paid videos also. WhatsApp 9226810630. Thank you very much for your patience hearing and always giving the support. So like this video, share this video, and please don't forget to subscribe my YouTube channel, because I am doing lot of effort, genuine effort for the students, for the teachers, for the doctors, for the common man, and for the patients as well. So I wish you all the best. Take care, and I say to you bye bye. Bye bye. All the best. Sarve